Hi everyone. Today in Cancer Disease Management, we are going to learn about cancer basics. Cancer is one of several diseases where cells grow abnormally. Cancer can start any place in the body. It can start in the lungs, breast, colon, and even in the blood. And we will learn about all of these types of cancers this semester. There are many different types of cancer. It is not just one disease. Cancers are alike in some ways, but they are different in the way they grow and they spread. The cells in our bodies all have certain jobs to do, and normal cells divide in an orderly way. Cancer is when the cells start to grow out of control. The cancer cells keep on growing and making new cells, which crowd out normal cells, causing problems in that part of the body where the cancer has started. Some cancers grow and spread quickly, while others grow more slowly. Most cancers form a lump called a tumor or growth, but not all lumps or tumors are cancer. Lumps or tumors that are cancer are called malignant. Why do these cells start to grow out of control? Cancer starts with a series of genetic mutations in a single cell. The cells begin to divide uncontrollably, and these new cells lack the characteristics of normal programmed cell death. The balance between the old cell death and new cell growth is disrupted. As the unchecked cell division continues, the new cells form a tumor mass and begin to crowd out the normal cells. As the cancerous tumor or mass continues to grow, the cells become wilder and look less like the cells of the organ in which they started. And at some point, they push their way through the basement membrane. The basement membrane usually provides a barrier between the epithelium of the organ and the parenchyma, where there are blood vessels and lymphatic channels that can provide nutrients to the tumor, causing further growth of the cancer. Now, the parenchyma is the functional part of the organ. Now, this is the process in which cancer can spread. Now, to understand how cancer spreads, we need to understand the different layers of tissues and how cancer can invade. Tumor that is confined in the epithelium is described as in situ or in place. At this point, the cancer has no potential to spread to other organs of the body. A tumor may stay in situ indefinitely. Once the cancerous tumor has gone through that basement membrane, it is invasive because it has the potential to spread through the blood vessels and lymphatic channels to other parts of the body. An invasive cancer may remain confined to the organ where it started. However, it does have two ways in which it can spread. The first way it can spread is through invasion of the direct extension of the cancer cells into the adjacent tissue near where the organ of the cancer started. The second way is by metastasis, where the cancer cells have the capability to penetrate into blood and lymphatic vessels within the organ and then can be carried into the circulatory system to other parts of the body. These other parts of the body can include the lymph nodes, liver, lung, brain, and all the other organs in the body. Now, to further understand how the metastatic process works, Cancer cells floating through the bloodstream or lymphatic system can be deposited in an organ away from the primary tumor site. Or cancer cells that get into the lymph vessels can be filtered out into the lymph nodes near the primary organ. Or cancer cells in the blood vessels can float into other organs and go through the membranes of the tiny capillaries into the parenchyma of a distant organ to begin growing there. Cancers of different organs can behave differently in terms of growth, invasion, and metastasis. Cancers in the same organ in different people tend to behave the same. For that reason, if we know how far the cancer has spread in a newly diagnosed patient, we can use our experience with previously diagnosed patients to get some idea of that patient's prognosis. The process of determining how far the cancer has spread is called staging. You will learn how to stage in semester 3. Cancer is a complex group of diseases with many possible causes. However, we do know for sure that there are some specific things that cause cancer, and those include genetics, tobacco use, diet and physical activity, or lack of, sun and ultraviolet exposure, radiation exposure, and other carcinogens. There are viruses that can also lead to cancer. The most publicized one at this time is HPV. But there's also the Epstein-Barr, hepatitis B and C, HIV, and human herpes viruses, which can also lead to cancer. This week's presentation was very basic, but it is necessary information to understand cancer disease management and the process of cancer and how it develops and why it develops. You ask, what is cancer disease management? Besides the name of the course, that is. Cancer disease management is the complete process of the diagnosis, treatment, and follow-up of a patient with cancer. Cancer disease management starts with the diagnosing of that cancer and continues until the patient expires. All patients that have been diagnosed with cancer should always be closely followed, since their risk for a second primary cancer is higher than the average person. You will learn in semester 4 that follow-up consists of the patient's status, are they alive or have they expired, their cancer status, do they have cancer or are they disease-free or cancer-free, and has their cancer recurred? And if so, are they treated? Do they become cancer-free again? And so on. Now, looking ahead to next week, the week 2 presentation will review the anatomy that is especially important to cancer disease. I realize that some of this might be a review from your anatomy and physiology courses, but it's essential that we review this information. We will also go over some cancer terminology to make sure that we're all speaking the same language. And we'll also have an overview of diagnostic tests, types of therapy, and specific cancer treatments. I hope you have enjoyed this week's presentation. Now, don't forget to complete this week's assignment. I hope you have a great week. I hope it's a great week 1 of semester 2 for you. And remember, if you have any questions, please post them in the virtual office. Talk to you soon and have a great day.